Hi everyone, welcome back. We're in segment 2, and I don't know if you've got your eye on it or your ear on it, but we're in segment 2. Yes, I'll be here all night, folks. So we kind of touched in the last segment on falls and fracture prevention. We were talking about eyes and how they can help with making sure that we can see everything properly, and if we don't, how that can affect our ability to walk, to stand, to balance. We see this a lot, in the younger population, but also in our seniors population. And this is really a population that you and I are very passionate about serving and making sure that they're heard and seen. So, without further ado, let's get into falls and fractures. Yes. As it relates to eyes.
Absolutely. So Dr. Teske, Megan and I are on a mission to really help improve the musculoskeletal health of all people 21 and older because of this new Health Canada approved bone scan that we've helped bring here to Canada, and we're educating about. Prevention is critical. So, and looking at not just quantity of bone, but quality of bone. But the other aspect that people may not think about when they're thinking about falls and fracture prevention. So anybody that's had an osteosound scan out there already, but you maybe haven't had your eyes checked and you don't know what's going on there. This is the role we're playing. We're not just here to check the status of your bones, your bone density, your bone quality, but we're also here to stock your toolbox. So Dr. Teske, let's dive into the eyes, how that impacts the vestibular system, what the brain does, and why we should care when it comes to falls and fracture prevention.
Well, thank you for that, Mark. Of course, the eyes are an extension of the brain. And the brain controls the nervous system controls the skeletal system. So when you impact one system, you impact all the other systems at the same time. So I think, again, in that theme of being preventative, 2/3 of patients that are senior will have falls. 2.5 times more likely to have a fall if there's low vision. Often patients don't know that they have poor vision or have limitations in their vision until they are assessed. Right. So if we're trying to prevent, then we want a checklist and make sure bone density, bone quality is good, vision is good, balance is good, hearing is good. We need all of the checks.
Right. So I think sometimes, and do you see this in your practice? Because how human of us, and it becomes human nature. When something becomes our normal, and for those that aren't watching on TV, I'm putting my air quotes up because what is your normal? It becomes your normal because that's what you're living with each and every day. I know you've been brought to tears in your clinic many times when you're restoring somebody's vision and they didn't even realize how bad they were because they didn't know how good they could be. And that has insidiously over time quietly crept into their overall health and their adaptation they've had in their life, right, to the way they live.
Absolutely.
What is that like for you as an optometrist? Like let's talk about that for people. Like what can they be looking for because they may think this is normal for them. What's normal and what's not normal when we're talking about eye health and falls and fractures?
You brought a valid point. People don't know what they don't know because they haven't experienced differently. And many age-related changes with vision are so slow and insidious that you don't recognize that things are changing until there's a crisis, right? So cataracts, for example, all of a sudden, especially if you need reading glasses now, you need to turn the lights up. Well, the lens inside your eye getting clouded is the reason why you need to turn the lights up.
Right.
So when my mom said, go to the window, the light's better, and I shrugged and said, really? I see just fine here because I was younger, didn't have issues. Now I understand what she meant. Go to the window because the light's better.
Right.
So having that cataract removed, often patients will complain, I see my wrinkles more. I see the carpet that I chose and I didn't realize. But these are all good problems. Right. So again, having that ability to see better when you didn't even know that you weren't seeing well.
Go ahead.
I was going to say, because I want to ask how the behavioral part of this, is it tied into that, or is this a place where we can segue into what behavioral optometry is in this particular segment? Yeah.
Behavioral optometrists really think beyond just eyesight, beyond just the picture that the eye brings to the brain.
Right.
But they extend that to the brain gets an image, and what does the brain do with that image?
Okay.
And, when you think in terms of behavioral optometry, you're really connecting all of those pieces. So you're connecting the brain to the body, to the nervous system, to, the vestibular system, and all of those things working together. to dictate your behavior. Right?
Yeah.
So,
Okay.
And those adaptive behaviors we start to do just to deal with our environment. So,
Right.
like you said, we turn the lights up more. We, you know, we
hold the
adapt.
pill bottle back here.
Exactly.
Or here.
Exactly.
Or somewhere in
Until
between.
it's not working.
Yeah.
And then you have to finally go and see your optometrist like I
Yes.
did and said, my arm's not long enough
Yes.
anymore, Dr. Teske. And she kind of laughed and said, yeah, well, welcome to the club. Is there not something, though, in healthcare about ageism, and especially with eyes? Yes, we do, just like our bones, we lose things as we age. However, let's talk about that from the lens of prevention. So is it ever too late, Dr. Teske, to start to change? And I know, you know, my mother's had cataract surgery. I know my mother-in-law is about to. There's sometimes fear around, oh, I don't want to do that, and I'm fine. And then, like you said, all of a sudden they can't believe the difference in what they're seeing, and their adaptive behaviors change because they don't need to make that adaptation anymore.
Yeah.
What about that when it comes to ageism?
yeah, you know, ageism has a role in every health discipline, I think. And patients take that perspective also and suggest, well, you know, I'm X number, I'm 80, I'm 90, then I should accept these changes in my body. You know, I can't drive at night and I don't want to drive anymore, so I just don't. All
Right.
of those things are not necessarily a fact. You know, I remember in my first years of practice, I sent a 73-year-old and a 100-year-old mom and daughter team to have their cataracts done at the same time.
I love
wow.
it. I love
And
it.
why not, right? We deserve to
Absolutely.
be
Yeah.
well at whatever number.
Yep.
But I think accepting that there's nothing we can do, I think in all of our disciplines is just not okay.
There seems to be a common theme in a lot of our podcast episodes, bringing different practitioners on. We just had a nurse practitioner on, Mandy Dickey. Shout out to Mandy, amazing woman, neurological nurse practitioner, sustained her own brain injury, and saying that she's challenging because she said she's now, talk about lenses, she's seeing the nervous system and brain in a different lens now because she's the patient, and it's changed the way she does everything. And that's what being open to this collaborative approach to medicine. We all have our specialties, but learning from one another. And at the end of the day, the person that benefits the most are the patients. And that's what this is all about.
This is what it's all about,
That's why
for
we're
sure.
doing this, right? Which is so incredibly important. So you talked a little bit about behavioral, as Megan was saying, and preventing falls and fracture, which is critically important, a part of our toolbox of musculoskeletal health. But it also plays a massive role, the eyes do, and we're going to dive in deeper on this topic, but in mental health. Why is that, and what's in your toolbox to help with mental health?
So, of course, because the visual system reports to the brain, you know, speaking of ageism again, often I'm asked the question, you know, if my parent has dementia or my spouse has dementia, should we even bother with cataract surgery? Well, we know that depriving your brain of input with eyes that should be better, could be better, exacerbates dementia.
Yes.
I think probably where I have seen the most information, you know, and the most care needed is post-pandemic or even through the pandemic. You know, I mean, from device use to isolation, you know, the visual impact that mental health has had, you know, I see it every day. People don't recognize that your vision can be blurred because you're in that fight or flight, you know, where your nervous system is in overdrive because you're anxious, because you're sleep deprived, because you have migraines. All of those things impact your vision.
Yeah.
When people, again, seek me out thinking they need glasses, when glasses really are not the root cause.
Right.
I think we need to clone Dr. Teske.
Right.
Just right
I've been
now.
trying for years.
Yeah.
I've been trying for years. But she is having an impact, and it is having this rippling effect. And she's leading the way when showing, even though with resistance, and that takes courage. You know, let's be candid. You were one of the ones to go first, which you know, you got some kickback. I've been around a while, but your shoulders are broad enough to say, no, I know when we know better, we should do better, and on always being open to continuing to learn for yourself and for your patients. And that's why, you know, these conversations are so important. And when it comes to mental health, you know, you actually have something called syntonics in your practice. Can you tell us what that is? Because that can actually, you've collaborated with psychotherapists that are treating people for depression and anxiety. What is syntonics, and why is it so impactful in mental health?
Well, how appropriate would it be for an optometrist to talk about light, right?
Yes.
So,
Yeah.
and if there's any experts on light, it should be optometry. So, light used as a therapy then through the eyes certainly can address the brain. And treating the nervous system, taking that patient's nervous system out of fight or flight and putting us into that rest and digest mode, where really all the healing occurs, has tremendous impacts.
Yes.
So Syntonics really is guided therapy. So we actually measure the peripheral vision of a patient, not a normal side vision test, but a specific one under colored lights, so we can determine what wavelength of light can be used to help the condition that seems to be causing most of the concerns.
Yeah. And you've seen some incredible results.
Yeah, absolutely. You know, it's dumb. It's, you know, almost unbelievable when patients will present to us, I can't tell you really why I'm better. All I can tell you is that I'm better.
Yeah.
I
Isn't that
sleep better, my appetite's better, my energy's better, my vision's better, my stress is less.
Yeah.
And I think that speaks to the testimony that when you impact one system, you're impacting them all.
So when would you decide to use Syntonics? And when would you, who's the patient that needs that?
Well, we probably all could use it.
Yes.
I think
okay,
I should
fair.
take a turn on
Fair.
occasion, but
Yeah.
you know, the patients that will benefit the most from Syntonics would be that anxious patient, the patient who is stuck and they're focusing spasm. Particularly, you know, our younger patients. You know,
I was just thinking that.
I have stopped saying don't use devices. Right?
Yeah.
Because that's ship has sailed.
Yeah.
Well,
Yeah.
devices are part of our world.
Yes.
Yep.
So I think now we need to educate on what devices do.
Yeah.
And especially for young patients who are not even looking across the street from, you know, a walking perspective, their heads
Right.
are locked on their devices. Then those patients, it actually is a tool to control that nearsightedness induced by stuck from
Right.
devices.
Right.
ADHD, ADD patients, you know, where focus is a problem.
Yep.
Migraines, you know, eye coordination problems, post-stroke. You know, there are so many applications for light therapy. And I think that the beauty is it's one more option to consider for patients.
Yes. Yeah, and I've referred patients to you and have seen tremendous results. And you, because you believe in the layering of tools, they do see that impact. But what's most rewarding, I think, as professionals that are in this space, is that the patient feels empowered. Because when you, and we're going to, in the next segment, dive a little bit more into, you know, other things like hormones and nutrition. And yes, nutrition, everybody, impacts your eyes. And some tips and strategies in your day-to-day that Dr. Teske is going to share. But these patients, when you start to feel like you have some control and you start to get those small wins, then you can make better choices in your lifestyle. Then you are moving your body more or drinking or hydrating or doing all the things that are not only going to be good for your eye health, your mental health, and what a difference that can make. And I'm sure you see that on a daily basis, which has got to be so rewarding.
It is incredibly rewarding for sure.
Yeah.
You know, that often, you know, the patient comes exhausted.
Yeah.
You know, they've tried all other avenues to be well. And Syntonics is just one thing where you really don't have to be an active participant.
Right.
I mean, you have to show up, but you show up and literally look down a tube and stare at light. So there's no, you know, take home required necessarily, as long as you're attending your visits. And really, we can see some tremendous results after even 10 visits.
So how long of a span of time are we talking? Is this something that people would have to do for the rest of their lives, or is
not
it?
at all.
What's the goal to, you know, if they're coming in, they're going to have this, you know, have Syntonics. You're recommending, say, 10 to 20 treatments. What is the span of time people are going to be, and then what's the outcome expected after that?
And obviously, this is patient individual.
Very individual.
Yes.
Yeah.
Because we have to tailor the treatment to the concerns, and often these patients have many concerns, as we all do, right? So the initial response, I would say, I expect from patients is after about 3 treatments. So we like to do 3 treatments a week, and each treatment at the most is 20 minutes, but often it's less because patients can't be there for 20 minutes. So we start with, you know, 5 or 10.
Right.
Particularly if it's an ADHD patient, then they're not sitting there for 20 minutes.
Right.
But most patients report change. And I think, you know, my goal always is progress,
Yes.
right? And what that looks like will depend on the patient. But after 10 sessions, we remeasure that visual field. so that we
Right.
can actually in degrees measure how much progress has been made. Most patients, even after 20, will say, okay, I feel good. So then they have a hiatus and take a vacation from Syntonics. Then life happens, and then they may need the tool again, so they can come back.
This is
So it's
so
not
amazing.
lifelong necessarily, just
Right.
one more tool in the toolbox.
Yeah,
literally.
that's great.
I really love that.
Well, yeah, and what I love about it is just giving options, as Dr. Teske
Yeah.
said, to consider, because there's not always just one way to deal with any one problem. So we're going to take a break here in a second, and we're going to come back. We're going to talk about those thing called hormones and what does that do with our eyes. We're also going to really talk about some little tips and strategies to put in your toolbox, not only to improve your eye health, but to improve your overall health, because as Dr. Teske said so eloquently at the top of the show, your eyes are a window to the rest of your health. Stay tuned. We'll be right back here on PHAMCAST. I'll see you back